What is up, you guys? So if you guys are experiencing pain right here, then stay tuned.
You go, I go, you stay, I stay.
Alright, welcome back to another video. So if you guys are experiencing pain right here in the front of your shoulder, some of the things that may be causing it is repetitive motions. If you guys like me, you train hard in the gym, and one thing that not a lot of people focus on is recovery. Yeah, we work out hard, but then we have slight injuries like shoulder pain or elbow pain or knee pain. But specifically, I'm going to talk about like the bicep shoulder impingement that you feel when you're doing like a bench or you're doing some sort of shoulder exercise, and you feel like you have anterior pain right here. It's caused by either a bench, or you can do a fly, or even some, shoulder raises right here, which I'll turn on the side, which causes your shoulders to round forward, and it causes the bicep tendons that attaches to the front of your shoulder right here to get kind of like squished and gets in the way, and then when you do like a bench and you're really tight, so your chest will kind of cave in, and when you're benching, it causes the bicep tendons that's here to rub against the bone and causes it to become inflamed. And a lot of times our shoulders are more rounded forward, and we don't necessarily stretch it to stretch our chest, shoulders, even bicep come into play, because it's actually the bicep tendon that's at the top that gets pinched in between the bone and causes the inflammation that we feel in the anterior deltoid right here. So no further ado, I'm going to show you some exercises and stretches that I do that helps me alleviate the pain. And also as well, I'm going to show you some tools that I bought on Amazon that you guys can purchase and use as well. Is the massage gun and cupping set that I use to help my shoulder. So not only is my right shoulder affected, we're going to do the same thing on my left shoulder, just because I don't feel pain there. I just want to make sure that both shoulders are nice and healthy and fresh and ready to go. Alright, for the first stretch that we're going to do is we're really going to focus on trying to stretch the chest, because the chest also attaches to the humerus, which attaches the bicep, and the shoulders are all attached right here. So we want to make sure, we want to get rid of the chest in the play. So we're going to really just stretch the chest, open it up. And what I like to do is find like a wall you may have at your home. So find a wall, and what I'm going to do is place my arm on it and keep it straight, and I'm just gently just gonna lean into it and really feel that light stretch. You don't want to overdo it and feel like you're straining yourself, or you feel like you're uncomfortable. Find that light stretch, hold it there for 30 seconds to a minute, and if you feel like you need to lean into it and get more of a stretch, feel free to do so. So 30 seconds to a minute there. And as I mentioned earlier, we're going to do it the same as my left side. Even though my right side is affected, we want to make sure we're staying balanced and one shoulder is not out of balance. So we're going to stretch. And then what I like to do after I do 30 seconds to a minute, I rest 30 seconds and probably do that 2 to 3 more times. Alright, so what we're going to do here is lay flat on our stomach, hands out wide, and what we're going to do is bring the left leg over the right leg. So we're going to twist, bring the left leg over the right leg, and with the left hand, we're gonna stretch up, and you should feel stretch in your chest and throughout your biceps. So we're gonna hold this again for 30 seconds to a minute. Really feel that stretch. Like I mentioned before, it shouldn't be too uncomfortable. Get that light stretch, and if you need to stretch a little deeper, you can. Again, so now we're gonna do the right leg over the left, and then push up with the opposite arm. And like I said, this stretches the chest and the bicep. Alright, another stretch that we're going to be doing is having our arm out straight and on the wall, and then we're going to bend it, and then we're going to twist away from the wall just slightly. You're going to feel a stretch throughout your whole bicep. So as I mentioned earlier at the beginning of the video, this is the shoulder impingement that you're feeling is caused by the bicep tendon here at the top. This is really going to help stretch it out. So hopefully try to open up your shoulders so that you can get your shoulder back into the right placement and not be so rounded over. So we're gonna get into it. So put my arm on the wall, and then we're gonna twist our body, twist this way, opposite from what our bicep, not too much, but you wanna feel a light stretch. You're gonna feel it all throughout your bicep here. So these stretches are for 30 seconds to a minute. And then the whole reason why we're doing both sides is we don't want any imbalances, so go for that. So rest for 30 seconds, do that 2 to 3 more times. Alright, some of the tools that I use here, I use this massage gun. It's the Amestina, if that's how you pronounce it, which is this. I picked it up on Amazon, which was I think around $55 to $60, which is super affordable. And it's a mini version, as you can see. It is this. It has a few different attachments that you guys can use, and the cupping set that I bought is the M-Bond, I think. So you can see there, that is the cupping set. So that comes with all the cupping accessories, and we'll show you guys that and how I use it. So the attachment that I first use is this pointed one, so I can really target in the spot, in the area that I want to target. So this has 4 different levels, so I turn it on. I usually start with the first one, then I go increase as needed. So I really, go in front where the, tendon is, in that right there where it attaches to. And then I go into the chest. You can move your arm, stretch it. I switch over and use more of a flatter tip one that I can just focus on more of the surrounding muscles, not necessarily getting and digging deep in there in the tendon area, just kind of loosening up the muscles around the tendons here at this point. So I'll do, top of the bicep here. Look at that shoulder here. Look at the chest as well. Really trying to loosen up this other area. So as you guys saw, we've done our stretches. We've used the massage gun on both sides, kind of loosening it up. I'm feeling a little bit better, but then we're going to finish it off with cupping, and I'll use the cupping and I'll explain to you, if you never used cupping before, it's pretty much what it does. It increases blood flow and circulation of the blood, and sometimes if you have like an injury or whatnot and it takes a while for it to heal, that means the blood is stagnant and it's not able to have really good blood flow in that area. So as you guys may see, this is kind of acute injury, but when I use the cupping and I kind of move my arm around to try to get more blood flow in there, it'll turn a darker color, and the darker color means there's toxins buildup in there, and we're just getting rid of the toxins in that area. So you might see, you know, dark red to purple even. Some areas you may put it on there for a little bit and it gets real dark purple, or it's just a light pink, and that means that area is getting more blood flow circulation than other parts that are darker red or purple. Alright, so I have the cups here. So here's the suction, and then you put it onto these cups here, as you can see. Put them here, attach them to the top, and just keep it there and just kind of move it around. Sometimes just kind of move it around here. Do this area, this spot that I put. Alright, I'll come closer for you guys. As you can see, I've been doing some already right there. It's getting darker. That means it's creating blood flow circulation in that area and drawing out some of the toxins in that area. So it's just pretty much drawing the, pulling the skin up so to allow blood to circulate through there. So we'll go do part of the upper chest, right? We'll just do it right here. Pump it up some, and we'll wait, and I don't know if you guys can see, but it should be turning different color. That's pretty much what I do. I just put it on the areas that it's affected and just kind of move my arm around, and then we'll pull it off, and as you can see, it turned a darker color. Some areas might be more darker, as you can tell, like up here it's more darker. That means less blood flow circulation. We can even go on here and just move it around. These, you know, red dark spots on my body, so this not really painful at all. It's just a light tugging on the skin. That's just about it. But it has a lot of, for me, it has a lot of benefits. It helps me with my shoulders, and as you guys can see, the shoulder is kind of red. I'll go over this a little bit more, and then I'll do the same on this side, and I'll show you guys at the end what it all looks like. Alright, so another thing that I like to do is I have a resistant bands attached to the bottom of the couch here. I'm going to do some external and internal rotations, and I'm going to do the 90 degrees backwards like that, all the way far forward as I can, and really go as far back as I can while trying to keep my elbow as straight as possible. So here I go forward, and then I rotate all the way back. It's going to help strengthen the shoulder and rotator cuffs, as well as stretching it out to alleviate the pain that around your shoulder. So that's why we do the 90 degrees. A heavy resistance, just a light resistance. We need a little bit more, give it a little bit more. And I'm going to do the same for both sides as well. So I did the internal, now I do the external rotations. Alright, there you have it. You guys can see I did the shoulder here. As you can see, some dark red spots, and I also did this shoulder too. I have a spot right here that's a little bit more red, but overall not too bad. I have a little bit there. I did go over this spot, but there's nothing really there. But just as you can see, the affected side here, there's a lot more redness here and the shoulder as well. But I like to do this shoulder as well, even though it's nice and healthy and I don't have any pain in that area, just to make sure it's fresh and good to go. So that's pretty much what it looks like afterwards. And on research and kind of looked at the benefits of it, and then I kind of tried it, and I've dealt with pain that I'm having right now on and off, and I've been doing this whenever I feel like I feel the pain, but majority of the time I try to do at least one day of the week where I spend 20 to 30 minutes just doing a full body stretch, which has been really helping. And then some days that I feel like I need to stretch more, I'll probably spend, a quick 5-10 minutes, just whatever body part that I worked on. So if I train legs, I'll, stretch my quads and hamstrings and all that. And feel free to comment down below. And if you guys like this video, give it a thumbs up. Make sure to subscribe, because we're trying to run this up to 1,000 subscribers. So we're at, I think, 136 subscribers, and a lot of you guys that watch my videos are not subscribed. So please make sure to just subscribe. And like I said, we're trying to run this up to 1,000 subscribers, and I want to help motivate and inspire all of you guys through my journey. And if you guys can comment down below on what kind of videos you guys want to see, it helps me out to know what you guys want to watch. So catch you guys in the next one, and we out. Boom!